So for my lightning strike, I am going to be talking about transgender athletes and the policies regarding them if they have equal opportunities in sport. So just for a little background information, I want to give some definitions. Gender relates to a person's internal sense of self, and sex is what is assigned at birth based on external genitalia. Gender dysphoria is a mental health disorder, and it is where the gender does not align with the sex assignment at birth. A transgender male is assigned female at birth but identifies as a male, and a transgender female is assigned male at birth but identifies as a female. And a cisgender is a non-transgender person. Prevalence of transgender in general is typically unknown, only because the data is not collected unless a person goes in for surgical or hormonal treatment. There is no standardized or routine collection of this information otherwise. So for the IOC, their guidelines are pretty straightforward. It is not required for anyone to have reconstruction surgery in order to participate, because that is deemed a violation of basic human rights. If a male wants to participate as a female, there are some guidelines. They must have the same gender identity for at least 4 years. They must prove the blood serum testosterone level, and it should be below 10 nanomoles per liter for at least 12 months. They must remain throughout their whole eligibility, and they are subjected to testing to make sure this stays underneath 10 nanomoles per liter. And then if a female transitions to male, there really are no restrictions. They are able to participate on the male sports teams. NCAA has really similar guidelines. A transgender male may participate on a men's team without treatment or with treatment, doesn't matter. Transgender female may not participate until 1 year of testosterone suppression treatment. And then they suggest that you get a letter from your doctor stating that you are undergoing treatment, and then a written request sent to the athletic director in regards to you switching genders on your team. Not all high schools have regulations, and not allowing high school athletes to compete with the gender they identify with could also be deemed unfair. For example, Mac Beggs is a Texas resident, transitioned to male, underwent hormonal treatment and everything, but was still forced to compete on the female wrestling team. And he went undefeated and won state championship 2 consecutive years in 2017 and 2018. High school policies may vary by state. So green means there's an inclusive policy, no medical treatment or surgery is required. Yellow means they need modification, they're not, and it also varies case by case. Red is a very discriminatory policy, and blue means the state has no policy whatsoever. So Virginia has an inclusive policy, and the athlete must simply submit lots of paperwork, go through approval process through the district. It seems pretty tedious looking at it, but unless you're going at it just for unfair purposes, they will approve it. So treatment for transgenders is cross-sex hormones. The patient may start this before puberty if they want to prevent any unwanted sex characteristics in order to improve their gender dysphoria and better align with their gender identity. The goal of this treatment should be to maintain the levels in the blood within the physiological range of the opposite sex. And sources vary on this, but generally men levels should be between 6.9 and 29.4 nanomoles per liter, and females should be less than 2.6 nanomoles per liter. And this treatment has been deemed safe, but should be continuously monitored to ensure long-term safety. A study by Gorn and Bunk found that testosterone levels in females was reduced to castration level, and their muscle mass was reduced after 1 year of treatment. There is not enough consistent evidence to show that transgender athletes have an athletic advantage in sport. So some recommendations would be the circulating testosterone level for female athletes should be below 5 or closer to the normal range for a female, and the IOC requires 10, so that's kind of a big difference. Research should continue to evolve as more training and performance studies need to be conducted to see if there really is a benefit or not. And maybe the term athletic gender could be adapted, so more policies would be clear regarding sex and gender. And this relates to athletic training because you never know when you're going to see a transgender athlete. And Ensign did a study to assess the attitude of athletic trainers towards transgender athletes, and the average score reported of comfort in dealing with them was very low, and they reported more comfort in a group setting versus a private treatment setting. And this is directly related to their education level and regarding transgender care. So athletic trainers could enhance the care of transgender athletes if they increase the amount of education they are receiving on transgender care, and then have a more transgender friendly clinic and environment. Transgenders are frequently not participating in sport because they don't feel included or they don't feel comfortable within that environment, and policies that prevent them from participating are very discriminatory. So overall, testosterone is not the only part of a person's physiology, so other biological factors should be included, and environmental factors, if fairness is really in question.